Hi y'all, my name is Lucely,
And I'm Caitlin.
and we're from the University of North Carolina at Charlotte. We are here to present our project on STD and STI prevention and awareness. Before we do this presentation, we just want to establish that this is a sensitive topic, but it is a serious one. So going forward,
So for this course, we had to identify a community and then a problem within the community to create a project. So we identified a problem within the Burlington community, since we are both local here. And we identified that Burlington community has an increased rate of rise of STDs and STIs. As evidenced by Alamance County being 29th out of 100 counties in North Carolina with the highest rising rate of new HIV cases that was found in the study. Another indication proving that this is a true problem is that in the North Carolina State Center for Health Statistics Alamance County assessment, they identified that the highest rates of HIV, syphilis, gonorrhea, and chlamydia were all within the age range of 20 to 29 years old. As you can see in our tables, we have a little bit of evidence, so you can just take a look at the trends. And one of the surveillance reports in 2020, it showed that the number of cases reported for chlamydia was found to be 926 with a rate of rise of 540.2, and then in 2021 there were 1,023 cases reported with a rate of rise of 588.3. And then in the same surveillance report for gonorrhea in 2020, there were 368 cases reported with a rate of rise of 214.7, and then in 2021 there were 524 cases reported with a rate of rise of 301.4. So as evidenced by these tables, you can clearly see that it indicates an increased rate of rise of STDs and STIs within the Burlington community.
So we're going to start off by explaining what STDs, STIs are. So STD stands for sexually transmitted diseases, and STIs stands for sexually transmitted infections. According to the CDC, they do use them interchangeably, but they can be viruses, bacteria, fungus, or parasite that people can get through sexual contact. Sexually transmitted diseases occur as a result of STIs. And some examples are chlamydia, gonorrhea, syphilis, genital herpes, HIV/AIDS, human papillomavirus, HPV, and trichomoniasis, hepatitis B, and bacterial vaginosis. So one of the questions we get asked is, can they be cured? So when it comes to bacterial infections like chlamydia or gonorrhea, often you're given an antibiotic and those can be cured. However, if it is a viral infection like genital herpes or HIV or human papillomavirus, those are treated with antivirals, and the antivirals are there to manage the symptoms. So they can be passed from person to person through oral, anal, vaginal sex, and from genital skin-to-skin contact. And some of the risk factors they've recognized as putting you at high risk of contracting these STDs, STIs are having anal, vaginal, or oral sex without condom or protection, having multiple sex partners, anonymous sex partners, and just having sex under the influence of a substance like alcohol or drugs, in which it lowers a person's inhibition and ability to consent.
So we just wanted to touch on some of the policies and regulations of STDs and STIs specific to North Carolina. Because Burlington is part of North Carolina's public health disease surveillance, which are in charge of continually assessing and analyzing the interpretation of data of what, where, who, when, and how disease occurred, all of which just means that North Carolina is mandated to report STDs and STIs. So, which diseases are reportable in North Carolina? According to the North Carolina Department of Health and Human Services, the following STDs and STIs are considered to be communicable diseases, which just means that they are mandatory to be reported by the following timeframes. So chlamydia has to be reported within 7 days. Gonorrhea has to be reported within 24 hours. Viral hepatitis B has to be reported within 24 hours. Viral hepatitis C has to be reported within 7 days. HIV and or AIDS must be reported within 24 hours, and then pelvic inflammatory disease must be reported within 7 days. In addition, syphilis is mandated to be reported within 24 hours. So you might be asking yourselves, who reports that? Do I have to do that? I mean, you could, but that is all taken care of if you were to contract an STD and STI. Physicians, school administrators, child care operators, medical facilities, and laboratories are the mandated ones who absolutely must report STDs and STIs. And they are to be reported to the Alamance County Health Department, who keeps track of the data. And then any confirmed syphilis cases have to be directly reported to the nearest communicable disease branch. And then if you or your partner or peer were to go to the emergency department in a hospital and were to come back with a positive STD or STI, then those cases have to be reported to the Division of Public Health, who then report their data off to the CDC.
So, you must be wondering why we've chose y'all to present this presentation or here on Elon campus. Is because it's a college campus, and according to a study in 2021, they saw that half of STD, STI incidents in 2018 occurred in people between the ages of 15 to 24. And so that's generally between like teenage years and like young adults, where y'all are transitioning from high school to college. And so we hope, because we've come to present this education project, we're able to provide education to y'all about the importance of safe sex practices, explain what they are, what STDs, STIs are, how to prevent them, how to use a condom and apply it the right way, and where to purchase the condoms in the community, or obtain these condoms.
So we kind of just wanted to give you a little bit of rationale of further explaining why we chose you guys, or Elon college students, to further implement our intervention for a community assessment project. So in a study in 2023, it was found that women are generally the ones who are expected to take accountability and responsibility for safe sex practices instead of men. And that isn't or should not be the case. Both men and women should take responsibility, as it takes two to tango. So, through social media and the internet, society has created this huge stigma that safe practices, safe sex practices, condom usage, and just STD testing is the woman's responsibility, just due to the female bodily autonomy, which enables men to leave the decision of safe sex up to women, when that is not correct. It should be up to both of the partners. If the man is not taking accountability, then of course the women should, but both partners should be held accountable to the same standards. And then in the same study, men were found to generally associate the usage of condoms with preventing pregnancy versus preventing STDs and STIs. So they have a lack of understanding of why a condom is actually used aside from just preventing pregnancy. It prevents both. Men also just avoid the conversation of safe sex, STDs, STIs, if they've been tested altogether. And then they assume that their female partners are on birth control, which helps prevent pregnancy and just mitigate that to preventing pregnancy instead of just thinking about STDs and STI prevention as well.
So one of the articles that we looked at back in 2023, titled "Exploring What Influences Heterosexual College Men in the Practice of Safe Sex." In this article, they assess the education, understanding, and behaviorals of sexual intercourse within heterosexual college men, and the results indicated that 83% of the participants engaged in vaginal sex, 27% engaged in anal sex, 76% engaged in oral sex, and 11.9% engaged in another form of sexual activity. These results are just saying that, it shows that college students are having sex, and so going further, only 22% of the participants reported always using a condom. 74% of the students engaged in sexual intercourse did not use a condom. And 66% of the students did not use a condom every time they engaged in sexual intercourse. So based off these studies, whether or not a condom was used was reported to be both of the partner's decision and not just one or the other.
To further elaborate why educating college students about STDs and STIs is important is because in an additional study that we came across in 2025, it indicated that women who are in their childbearing years, such as college students, they face a higher risk of contracting an STD or an STI as opposed to men because of gender disparities and just overall limited access to education and economic opportunities that's presented to them. So in an article titled "Prevalence and Factors Associated with Sexual Transmitted Infections Among Women of Reproductive Age in Tanzania," the authors conducted the study based off of a questionnaire, which they found the following results to be true. So in the Lake Zone area of Tanzania, 43.7% of the participants who were of reproductive age reported having an STI genital sore or genital discharge, which is often symptomology of an STD or STI. And then in the same study, it was found that women between the ages of 24 to 34 presented with a higher risk of contracting an STI due to engaging in risky behaviors, misuse of alcohol, having unprotected sex, and having multiple sexual partners, which, as you can see, most of the age range is college student age, and some of those activities and behaviors are being seen in the college environment.
Going further, in one of the studies in 2023, it showed that many young adults do not receive the recommended sexual health services like getting screened for STDs regularly or counseling if need be. And then in that same study, it showed there's limited knowledge and actions of getting tested for STDs and STIs in this population of young adults, especially those on college campuses. And individuals who are in their college years are more susceptible to STIs and HIV infections due to gaining independence and being in an unsupervised environment with opportunities for risky behaviors. Going further, this study highlighted barriers as to why these students or these young adults were not getting tested, and identified some reasons as to financial concerns, lack of privacy and confidentiality, the effects of social stigma, the accuracy of the test results, and the risk of parents finding out as a barrier.
So now that you guys are educated about what STDs are and just the overall data that's out there about why you guys are the most vulnerable population, we want to give you some resources on where you can go within the Burlington community to get tested for STDs and STIs. So here locally, you don't even have to go very far if you live on campus, is the Elon University Health Clinic, which per their website, usually they file your medical insurance. However, you can opt out of that and ask them not to do so, and then the university will cover the charges associated with it. And then here within the community, you can go to the Alamance County Health Department to their STD clinic, which per their website, it is free services. You can also go to Burlington Health Center, Piedmont Health. You can go to the Open Door Clinic of Alamance County, which their services are kind of adjusted for your financial situation. And then you can also go to private clinics, doctor's offices, any urgent care. You can also go to the CVS Clinic. CVS and Walgreens actually have self-testing that can be purchased over the counter. However, we recommend going to have a blood test, as those are more accurate. And then last but not least, if you feel inclined, you can go to the Alamance Regional Medical Center to get tested as well.
So where to purchase condoms? So free of cost, y'all could get them on campus in the Student Health Service Center. Y'all can also go across town to the Alamance County Health Department. Other options that are not free, but they might be close by, are any convenience store or gas stations. That being said, like CVS, Walgreens, Walmart, and Target, and Publix. And so we would also like to go step-by-step directions on, we would also like to explain how to apply a male condom. That can also help reduce transmission. And so we would start by looking, so check the expiration date, making sure it's within the date that y'all are using it, and then going further, after opening it, making sure the rim of the condom is on the outside. If you accidentally put it on inside out, just get a new one, just to be safe. And then place it on the head of the penis, leaving a little bit of skin at the top to collect semen. And then if you or your partner are uncircumcised, just pull the foreskin back before placing the condom on. And then unroll the condom down the shaft of the penis all the way to the base of the penis. Just be careful not to poke any holes in the condoms. And that is it. And Caitlin's going to explain how to remove a male condom.
So applying a condom is important just as the removal process is, because if semen escapes, then that is where you get the transmission of STDs and STIs. So after ejaculation, you want to be sure to hold on to the rim of the condom and pull the penis out of your body's partner. You want to do this before the penis gets soft so that the condom doesn't get too loose, allowing for semen to escape. You then want to carefully remove the condom and properly dispose of it. So we've provided a lot of information and education to you guys, and lots of resources about STDs, STIs, where you can go to get tested, where to buy condoms, even how to put them on and take them off. So to ensure that our education is effective, we are going to assess Elon College students' understanding, you guys, about STDs, STIs, such as what they are, how they're contracted, whether or not they can be prevented, where you can go to be tested locally in the community, and then just different treatment options if you do happen to get an STD or an STI. We're also going to assess y'all's willingness to learn, as well as implement the associated interventions to prevent the spread of STDs and STIs that we talked about today. We're going to provide you with education about safe sex practices and the importance of using a condom, as well as the correct way to apply and wear one, and where you can obtain them from, which we already did. And a recap will be on this handout that we hand you guys at the end. We're also going to include resources on that handout about where you can go to learn more about STDs, STIs, buy condoms, get tested for STDs and STIs, and then receive treatment. And then we're going to emphasize the importance of preventing the spread of STDs and STIs and protecting yourselves from them. So truly, guys, like STDs and STIs are something serious. It's a health concern of the community that we are trying to decrease. So we are going to, in a little bit, hand you a survey that's going to help us measure the results and effectiveness of all the education that we provided you and determine how many of you and your peers out in the community are willing to change your sex practices.
So our goals after this presentation. Let's start with the short terms. So we hope after this presentation you have a better understanding about STDs, STIs, ways to prevent STDs, STIs, safe sex practices, where to purchase condoms, and where y'all can get tested. We hope that y'all will begin practicing safe sex and will start using condoms within 1 month of hearing this presentation. And then we hope that y'all will get tested for STDs, STIs within 1 month of hearing this presentation if y'all have not already gotten tested. And so long term, if we're practicing safe sex, using condoms, getting tested as we should, and this involves like just regularly and then before you have a new partner. And so we hope that by doing all these within the next 5 to 7 years, there will be a downward trend in the rate of STDs and STIs in the Burlington community.
And here are our references of all the data that we use to present, to put together this presentation and educate you guys about. While my colleague is going to be handing out the survey and the handout to you guys, I'm just going to go over real briefly our survey, the screening tool that we're going to use to assess our effectiveness. Just in case you have any questions, feel free to come up to me after this and we can discuss it a little bit more, but it's pretty self-explanatory. First question being just indicate whether you're a male or a female. Next question is just asking you what your race is. The next question would be, prior to this presentation, did you know what an STD or STI was and how they were spread? Simply check yes or no. The next question is, prior to this presentation, rate your knowledge level about how to prevent and protect yourself from contracting an STD or STI, and then just you rate your knowledge from no to very little, moderate, or a lot. Next question, after this presentation, rate your knowledge level about how to prevent and protect yourself from contracting an STD and STI. Hopefully all of you choose very knowledgeable. The next question would be, prior to this presentation, did you know that condom use helps prevent the spread of STDs and STIs and not just pregnancy? Yes or no? Next question, true or false? Birth control helps prevent the spread of STDs and STIs. Simply true or false. The next question is, prior to this presentation, were you aware of where you could find or purchase condoms within the community? Yes or no? Prior to this presentation, were you aware of where you could go to get tested for STDs and STIs within the community? Yes or no? After this presentation, how likely are you to practice safe sex behaviors and get tested for STDs or STIs? Extremely unlikely, very unlikely, somewhat unlikely, neutral, somewhat likely, very unlikely, very likely, or extremely likely, which we hope is extremely likely. And that's it. And then we'll, of the papers she passed out, it's just our little handout that we have for you guys to recap everything that we discussed.
And going back on the survey, we also have a portion where y'all can provide feedback, and if there's anything that we can do better or approach it differently, let us know. And we would also like to thank y'all for your time. As I said, this is a sensitive topic, but it is important, and we really appreciate y'all being here.
Yeah, so make safe choices about safe sex, STDs, and go and get tested and tell your peers. Thanks, guys.